Hello everyone, I'm Harshita Vijayvargya, and today we have with us Dr. Nischal Bhatt, the renowned child specialist and teenage health consultant. Being curious about child psychology from his graduating years of MBBS, Dr. Bhatt then pursued MD in Pediatrics from MS University, Vadodara, followed by post-diploma course in Adolescent Pediatrics from Kerala University. Dr. Bhatt is recognized as Adolescent Health Ambassador in India and has conducted several adolescent health workshops in more than 50 cities of India. Dr. Bhatt has also served as Honorary Secretary of Pediatric Association of Gujarat. The inclination of Dr. Bhatt towards empowering parent-child relationship led to the inception of PARENTeens, and the first workshop on the concept witnessed the participation of more than 50 families and is now a proven success. To throw some more light on the concept, we have some questions for Dr. Bhatt. And to start with, the first question is, Dr. Bhatt, you have chosen adolescent healthcare. Is there any incident that inspired you for this?
First of all, I must congratulate and thank Docplexus for inviting me to talk on this subject, because I am extremely passionate and extremely eager to talk about this subject in any platform that is available. Now, coming to your question, how did you get particularly interested in this area? After starting my private practice in Ahmedabad for more than 10 years, what happened was, by the end of the day, I was started getting little unhappy about what I was doing, wanted to do something to give back to the society. So during that area, I come along with a book of Dr. APJ Abdul Kalam named Ignited Minds. And he has talked a lot about adolescent health. Adolescent is the coming up area. India is adolescent, or you can say it is a young country, and in which what is happening is that 22% of the Indian population is of adolescent age. And I just started finding and searching where I can get extra information on this area. I found out that the Kerala University is the only university across India has a postgraduate diploma course in this field. So it was a 2-year course along with my private practice which was going on. I pursued that course. After completion of that course, I have started going to various schools to take workshops with teenager boys and girls on life skills. Within 6 months, I realized that only working with teenagers will not give me the proper result that I was looking for. So I started including parents into it as well as teachers into it, because the environment around teenagers makes lot of influence on their behavior. So by that time, in 2012, I have coined the term called PARENTeens. It is a workshop for parents and teenagers to make a family that they really want. So this is the way the PARENTeens has come into the existence since 2012.
Great. So then why do you think it is important to counsel parents and teens in this era? And do you think the current lifestyle, it is helping to bridge the gap, or it is the main concern after all?
True, absolutely. With my experience and what literature I have gone through, the current lifestyle is the main concern. What has happened in 21st century, that is in past 15 to 20 years, is the joint family structure of India is now disintegrating. What was happening in the past, that a huge family is residing under one roof. There is one person who is deciding what is right and what is wrong. If there any concern or question or a stress to any one family member, there are people around that person to support that one. But as the economical growth has happened, people have started moving from their parental house to settle at another place. So majority of them have become now nuclear family. So there is a father, mother and 1 or 2 kids staying in one roof. Most of the time, because of the fast life and requirement to earn better living, both the parents have started working. So there is less and less time which is happening amongst the family. The children are left alone at the home at the cost of earning more. So these are the things which is really causing lot of stress. When a family person is not happy or having some concern about his or her life, there is nobody is there to support at that time. Another thing which is happening in last 15 years is a lot of media and internet is coming into the place. The smartphone, the internet, the TV is there in the bedroom of the people, and that really is creating lot of stress, tension and wrong behavior in teenagers. There is one word which was coined in 2012, they call it fubbing. Fubbing is when two people are or three people or four people are sitting in one place, they are not interacting with each other, they are on their mobile or smartphone. So now they call this as fubbing. It was coined in Australia in 2012. Lately, since last 15 years, there are a lot of safety issues which are happening. Abduction, kidnapping, sexual trafficking, then road traffic accident has increased. The risk-taking behavior of teenager causes lot of concern in the family. Another thing is lot of competition and comparison in the field of studies, because so many areas to work for and the peers are affecting teenagers thinking about what career to take. Lot of competition is there, and because of all these issues which has happened in last 15-20 years, this lifestyle causes lot of stress, tension in the family, and to be very frank, they are not able to live the kind of family that they really want to live happily. So these are all things which we must take care of when we are dealing with parents and teens in this 21st century.
Completely related to. So empowering parents and teens, that has been your motto. So how would you differentiate the counseling that you provide and others provide to parents and teens?
Absolutely. The first thing is that a pediatrician is a very noble person. Any parent would be very happy to take their teen to a pediatrician for routine checkups. Easily approachable because there is no stigma or taboo associated with a pediatrician. When a parent want to take a child to a psychiatrist or a psychologist or a gynecologist for any concern, there is some stigma or taboo attached with that, which is not there when I am counseling or talking to the parents. Another thing is, my being a medical doctor, I know the physical development of a teenager. I know the differential brain growth of any teenager, which is causing lot of stress into his or her upbringing as well as to the parents. I know that the psychological changes which happens in any teen, how to deal with it. Another thing is, I myself is a parent. I have a 15-year-old child studying in 10th. So I am going through his development. So I am in a better position to counsel or talk to any parent. The last thing is, because of all hormonal changes, physical changes, the development, the questions that a teenager have because of changing in hormones and emotions, I can relate with that teen, so that it makes me a proper person, so that I can give a counseling to parents as well as to the teens.
Exactly. So this is about communication. So
True.
then how exactly would you mean by healthy and unhealthy attention to teens, mainly focusing on communication?
Yeah, very good question, Ashita, because we have been seeing that there is a generation gap, and lot of generation gap creates lot of stress between two generations. But let me tell you one thing, it is not the generation gap, but it is the communication gap between two generations which creates lot of hassle and stress in the family. Now, very crucial is to learn to effectively communicate with your teen. Why? Because majority of the time teens have difficulty in expressing their emotions, because lot many things which is going on in their mind, and they are not able to put it in a proper word that an adult can understand. That is number one. So any adult, maybe parent or a doctor, communicating with a teen should learn to listen more and speak less. because majority of the time when a parent or a doctor starts talking to the teen, they just speak and speak. They don't give time to listen to the kid. Another important thing is, whenever you are listening, you should not do jig. What do I mean by jig is, first J is, you should not be judgmental. You should not interpret each and every word or sentence that has been said to you. Most of the time when somebody is speaking, we evaluate what has been spoken, why it has been spoken. We many a times compare with what we already know, and many a times we have that complaint whatever has been spoken. So this jig, if we keep aside and just listen to what teenager is trying to convey to you, then 80% of the things that a teenager has can be taken care of by just listening to the teen. The last thing is, whenever you are dealing with your teen as a parent or as a doctor, 3 important L's. First is, you must deal with your teen with love. You must keep certain limits in that child's behavior and give him latitude, that is freedom to explore and experience the things. If you take care of these points while dealing, definitely the communication becomes absolutely easy, and teens can decide what is right and what is wrong even if you are not there. So that is the ultimate goal of any parenting issues.
Agreed. So you have been working relentlessly on your organization, PARENTeens. So then we would really like to know, how did it start and what are the kind of projects that this organization has taken?
Yeah, since 2012 I have been working lot of projects which I have done in last 4 years. In the beginning I used to go to various schools to create workshops with boys, girls and parents and teachers of that school, as well as I have conducted workshops with various clubs. Also, many medical associations have invited me to conduct workshops for their doctor families. The corporates are also really interested in this kind of activities. So I have done workshops with corporates, I have done workshops with pharma companies. Even I took opportunity to work with pediatricians to understand adolescent. And that is very unique, because in our curriculum, when we are studying pediatrics, we have been majoritarily trained to take care of kids till 12 years. And there is distinct difference between taking care of a kid up to 12 and after 12 to 18. So I do take workshops with pediatricians to train them how to take care of a teen in an office practice. So these are the various fields or various platforms in which I have done lot of activities on parenting.
As we know, Docplexus community has come up with various solutions to the problems that the doctors community is facing. So then what do you think is the impact of Docplexus on the doctors community?
Yeah, I have just come to know that Docplexus has achieved a milestone of registering more than 130,000 allopathic doctors on their portal. That is an excellent achievement. And I also come to know that there are more than 10,000 doctors who are practicing pediatrics or allied branches are then on this portal. Now, what I can say is Docplexus is a real-time online activity, and it is available everywhere. Wherever you go, you can access that easily. That is number one. Second is, whatever issues a doctor is facing can put online, and you can get lots of opinion on that issue, and whatever suits to your patient you can apply on your patient, and you can really learn lot of things from other doctors. The third most important thing is, you can get an expert opinion, because there are experts of all medical fields are on Docplexus portal. So whenever you are facing a difficult case, you can definitely put on the Docplexus, where the experts can come and give the opinion. So these are the very, very important issues where a doctor can take the advantage of Docplexus platform to increase his clinical acumen as well as increase his or her own practice in real time.
Thank you so much, Dr. Bhatt, for sharing your views on current scenario of teenage health in India. We are really looking for the next part where we'll be discussing the factors and strategies that other doctors and clinicians should consider while dealing with teenage health. Thank you so much.
Thank you so much. Thank you.
These interviews and events are featured by Docplexus exclusively for the doctors of Docplexus community. To receive updates regarding such upcoming events, please subscribe and like our YouTube channel, like our Facebook page, and follow us on Twitter. Happy Docplexing!